Welcome to the presentation on diabetes. At the end of the presentation, there will be an exam. Please navigate to it and complete it to the best of your abilities. Diabetes, the numbers. About 7% of Americans have diabetes, and it's the sixth leading cause of death in the United States. What is it? Insulin is a hormone that helps the body to process sugars into energy. Diabetes is a disease in which the body does not use its insulin properly, or it does not produce enough insulin. The result is elevated blood sugar levels. Symptoms and signs: extreme thirst, extreme hunger, weight loss, frequent urination, vision changes, and recurrent infections. Diagnosis: fasting blood sugar greater than 126, 2 random blood sugar tests greater than 200, and after fasting and drinking 75 grams of sugar, 2-hour postprandial blood sugar greater than 200. Types of diabetes. Type 1, or juvenile diabetes. The body does not produce insulin. Present from birth, it's a genetic defect. Type 2, adult onset. The body does not use its own insulin properly, called insulin resistance. May lead to type 1. It starts well after birth, usually in the adult years. Gestational diabetes occurs only during pregnancy. Some women go on to develop type 2 diabetes. Type 2 diabetes. This is the most common form of diabetes. It's insulin resistance, and the onset occurs usually in adult years. Risk factors for type 2 diabetes include being overweight, family history, a prior history of gestational diabetes, and being an African American. Treatment: injectable insulin, short-acting, medium-acting, or long-acting, oral medications, increase insulin secretion, increase insulin sensitivity. Insulin, rapid-acting, Humalog or Novolog, short-acting, regular, intermediate-acting, NPH, long-acting, Lantus, 24 hours, mixes, combinations of the above. Keep unopened bottles in the refrigerator. Insulin will stay fresh for 1 month without refrigeration, under 86 degrees Fahrenheit. Check insulin before using it. Short-acting and glargine are clear. Intermediate and long-acting are cloudy. If clumps are visible, throw the bottle away. Testing blood glucose helps assess how well blood glucose levels are being controlled. Helps guide changes in medications. Very important if insulin is being used. Should be tested if hypoglycemia, low blood glucose, is suspected. Testing times vary, typically 2 to 4 times a day. Before meals, 90 to 130 is where we should be at. 1 or 2 hours after meals, less than 180. Testing is prescribed by a doctor, usually fasting morning, before meals, and bedtime. Hypoglycemia, low blood sugar, occurs when blood glucose drops too low. For most people, this is less than 70. It can be life-threatening. Symptoms may include nausea, dizziness, and sweating. Keep a source of glucose readily available. 2 glucose tablets, 1 cup of milk, or half a cup of juice. Retest after 15 minutes. Carry glucose tablets when exercising. Hemoglobin A1C. Tested with blood samples. 3-month average of blood glucose readings. Guides decisions about treatment. Keeps track of your values. Normal is a 4 to 6% for someone who's a non-diabetic, and the goal is as close to 6% as possible. Non-pharmacological treatment: diet and nutrition, exercise and weight loss. Nutrition. What a person with diabetes eats is very important. It's more than just not eating sugar. Glycemic index. Rating system based on how fast the food raises blood glucose 2 hours after eating. Reference is white bread, is equal to around 100. The higher the glycemic index, the faster the food raises the blood glucose. The faster the blood glucose rises, the more quickly insulin is released. In diabetics, because of the insulin resistance, the body doesn't respond as well, so glucose levels stay higher longer than normal. Lower is better when it comes to the glycemic index. For example, a high glycemic index would be white rice, white bread, or potatoes. Moderate glycemic index could be rye bread or macaroni and cheese, and low glycemic index would be banana, milk, grapes, or brown rice. Diabetic diet. Keeping blood glucose in the normal range decreases the likelihood of complications. More than just not eating sugar, or it's eating the right foods, at the right times, in the right amounts. A diet of around 1,500 to 2,000 calories a day for most men and women, 40 to 60% of these calories being from carbohydrates, 20% from protein, and less than 30% from fat. Each meal should have around 60 grams of carbohydrates, including fruits, vegetables, dairy, or starch, sugar substitutes, low fat and low cholesterol. Eat at the same time each day and eat structured meals. Exercise. Always warm up and cool down for about 10 minutes. Check blood sugar before and immediately after exercise. Do not exercise if your blood sugar is greater than 250 and eat a small snack if it's less than 100. Drink 2 cups of water before and after exercise. Control your weight with good nutritional choices and increasing activity. That sounds like a lot of work. Is it worth it? Yes. Common complications. Blindness due to bleeding blood vessels in the eye. Kidney failure, which can lead to dialysis. Stroke, heart attack, and numbness and tingling. Neuropathy. Gum and teeth diseases, foot problems, infections, and potential amputation. Treatment. Healthy diet, exercise, and weight loss. Medication to lower your blood sugar. Medications to lower your blood pressure, or to lower cholesterol and protect the kidneys. And check your feet each day. Follow up with your doctor. Aspirin for diabetics over the age of 40. Bad cholesterol, LDL, goal is less than 100. Examination by ophthalmology yearly. HbA1c every 3 months. Urine check for protein every year. Foot check every 3 months. Pneumococcal vaccination, and blood sugar goal of less than 130/80. Who should be screened? Persons with hypertension, persons with hyperlipidemia, and others at the discretion of the physician. Warning symptoms. A history of illness or infection, nausea, sweating, vomiting, foot ulcers. Warning signs. Blood sugar less than 70, a blood sugar greater than 300, increased heart rate, increased respiratory rate, and foot ulcers. All vital parameters are determined by an RN supervisor and they are patient specific. Other warnings. Not taking medications. This concludes the diabetic presentation. Please proceed to the exam now.